Hi everyone, this is Dr. Richard Tran from Color Chiropractic out here in Bellingham, Washington. I'd like to talk today about people that have multiple conditions that are going on in their bodies. Um, Sometimes finding out the causes of what's contributing to these conditions can be difficult. A patient might come into me for like a lower back or shoulder related issue, but when we dive into the history more, it's more than just that. They may have things like sciatica, they may have like a peripheral neuropathy, they might even have sinus congestion or headaches, irritable bowel syndrome, chest pains, and a lot of times they may be looking at different practitioners to help them out with these types of things. Well, in a holistic perspective, we've been taught to consider that we want to take a step back and seeing what's actually going on in the body in terms of the physiology. So what I wanted to do with this is to discuss some potential considerations that you might want to look at. We'll talk about the physiology of how the body works in developing these types of problems, things that we look at to be able to help resolve the conditions, and even things that you might be able to do at home. So let's go ahead and get started. So when it comes to these different types of conditions, one area that you really want to look at is your digestive system. Now, some people might not even have digestive related symptoms when it comes to things like your lower back or your shoulder pain, but it is a key area that we look at in more of a holistic model when those traditional approaches like adjustments don't necessarily work. So to kind of explain it, in the digestive system, there's a particular area between your small and large intestine called this ileocecal valve. This is a valve, kind of think of it kind of like a trap door that swings open and close. Your small intestine and your stomach are reserved for areas where you're absorbing the nutrients that you're taking in, and the contents that you want to expel out go into your large intestine. Well, if this ileocecal valve is actually swung open, then you can imagine that contents coming from the large intestine backflow into the small intestine. And just to kind of review a kind of understanding of this, if the contents in large intestine are flowing back, then the toxins are flowing back there. That can cause things like those headaches or like the sinus congestion. Okay, at the same time, it can also cause inflammation and pain. The other thing that happens is that the body's attempt to try to neutralize the toxins that have backflowed can also lead to dehydration, because your body will try to flood those toxins with water in order to try to neutralize it. So that's kind of a link up on why your digestion can lead to things like the inflammation in your lower back or inflammation in your shoulder, even the peripheral neuropathy or the headaches that you experience. Let's discuss some different things that we look at in order to really do something about it. So in terms of considerations, it can be pretty extensive. There's a lot of different dynamics that we're dealing with that can relate to a valve that isn't working properly. A mnemonic that I was taught that helps me to hone in is DAPES, diet, allergies, parasites, emotions, and your spine. There are different techniques that we apply to looking at each of those factors and seeing whether those factors are irritating the valve in one way or another. Sometimes, doing an adjustment, the right type of adjustment can be able to help. Sometimes it's a matter of supplementation, balancing out the gut flora. There's certain nutritional products that we look at with that. Sometimes emotional balancing can really prevent the valve from either swinging closed or open. So those are all different things that you want to be able to look at. So when it comes to healing this ileocecal valve, there's a number of different things that you can do. One of the things that we would suggest is going on ileocecal valve diet. Now this is a 10 to 14 day diet. It's not something you need to be on forever, but just long enough to allow it to heal. You want to eliminate certain foods like popcorn, chips, nuts, seeds, spicy foods, alcohol, and caffeine. Fruits and vegetables in their raw form are okay if you chew them properly, but more times than not, you'll probably want to steam them because those raw vegetables can tend to more irritate the valve and take the valve longer time to heal. There are also some lymphatic points, which I'll show you on this page here, that you can rub depending on which valve is, whether the valve is actually swung open or swung closed. Now, you can actually give us a call at our clinic to be able to make recommendations on which ones that you rub, but feel free to do that and ask any questions. So I hope that this video was useful. Hopefully it gives you some insights on things you can do. And feel free to leave a comment. We hope to be able to hear from you. Thanks.